The mammary gland. Objectives. At the end of the video, you have to be clear with the location, extent, relations, structure, blood supply, nerve supply, lymphatic drainage, and the clinical aspects related to the breast. The breast. It is found in both the sexes but is rudimentary in the male. It is well developed in the female after puberty. It provides nutrition to the newborn in the form of milk. Its shape may be hemispherical, conical, pyriform, pendulous, or flat. Location. The breast lies in the superficial fascia of the pectoral region. It is divided into 4 quadrants: the upper medial, upper lateral, lower medial, and lower lateral. A small extension of the upper lateral quadrant is called the axillary tail of Spence. It opens into the axilla via the foramen of Lange. The base is circular. Extent of the base. Vertically, it extends from the 2nd to the 6th ribs. Horizontally, it extends from the lateral border of the sternum to the mid-axillary line. Deep relations. The deep surface of the breast is related to the following structures in that order: the pectoral fascia, pectoralis major, serratus anterior, external oblique abdominis, retromammary space. The retromammary space is a loose areolar tissue that separates the breast from the pectoral fascia. The normal breast can be moved freely over the pectoralis major due to the presence of the retromammary space. Moving on to the structure of breast. It is studied conveniently by dividing the breast into the skin, the parenchyma, and the stroma. The skin has a conical projection called the nipple. The pigmented area around the nipple is called areola. Tubercles of Montgomery are the enlarged sebaceous glands during pregnancy and lactation. The parenchyma is the mammary gland, which has 15 to 20 lobes. The lobes have ducts which enlarge at the end of the nipple to form the lactiferous sinus. The stroma forms the supporting framework of the gland, which is partly fibrous and partly fatty. The suspensory ligaments of the Cooper anchor the gland to the pectoral fascia. The fatty stroma forms the main bulk of the gland and is distributed all over the breast, except the areola and the nipple. Moving on to the blood supply. The arterial supply is mainly through the internal thoracic artery, lateral superior and acromiothoracic arteries, lateral branches of the posterior intercostal arteries. The venous drainage is through the superficial veins which drain into the internal thoracic vein and superficial veins of the lower part of the neck, and is also through the deep veins which drain into the axillary and posterior intercostal veins. The lymphatic drainage. The subject can be described under 2 heads: the lymph nodes and the lymphatic vessels. The lymph nodes are the axillary lymph nodes, anterior thoracic or parasternal nodes. Some lymph from the breast also reaches the supraclavicular nodes, cephalic, deltopectoral node, posterior intercostal nodes, and the subdiaphragmatic and the subperitoneal lymph plexuses. The lymphatic vessels include the superficial and deep lymphatics and also the subareolar plexus of Sappi. Nerve supply. It is through the anterior and lateral cutaneous branches of the 4th to 6th intercostal nerves. These convey fibers to the skin and autonomic fibers to the smooth muscle and blood vessels. The development of the breast. It is through the mammary ridge or the milk line of skulls, which is around the 4th week of intrauterine life. The gland is ectodermal and the stroma is mesodermal. The developmental anomalies. Amastia, the absence of breast. Athelia, the absence of nipple. Polymastia, supernumerary breast. Polytelia, supernumerary nipples. Gynecomastia, Developments of breast in a male which occurs in Klinefelter syndrome. The clinical anatomy related to the breast is mainly the CA breast. The upper and outer quadrant of the breast is a frequent site of carcinoma. The first lymph node draining the tumor bearing area is called the sentinel node. Pudorans appearance is orange peel-like appearance which forms due to the obstruction of the lymphatics supplying the breast. The mammogram. Mastectomy is the removal of the breast. Radial mastectomy is the circular incision given to the removal of breast. Lumpectomy is the removal of the lump or the tumor which is in the breast. The pudorans appearance relating to the peel of an orange. The mammogram showing a cancerous lesion. And assess your gain. What is the vertical extent of the breast? What are the tubercles of Montgomery? What is the frequent site of CA breast? What is the sentinel node? Check out the next videos for the answers. Ease my med.